is stuck in a slogs. Sports and regenerative medicine therapy. I have a lot of runners in my practice, and they're some of the most difficult patients I have because runners like to run. They get the runner's high and they don't want to quit. The problem is, with time, and if you develop osteoarthritis of your knee, it's an impact sport, and it's often very difficult to continue running when you have significant arthritis of your knees. The knee is composed of really three joints: a lateral and a medial joint, which is where the lateral and medial meniscus are, and actually where the patellofemoral joint is. So some people have arthritis on the surface of the kneecap, or some people have wearing of the medial or lateral meniscus, or all three. But anything that loads and impacts the joint, and the knee is a shock absorber, will put undue stress on it. The more you run, the more stress. I had one particular marathoner that I kept treating, and he did very well after we did regenerative therapy and stem cells on his knees. Every year he'd come back, "Doc, one more Boston." So I'd do it again. Come back the next year, "Doc, one more Boston." Did that a total of 3 times. Last time he said, "I'm done." He hasn't had another one. He sent his wife, and she said he's still doing good. I have another very complicated patient, this gentleman up here, who is an Ironman, which is even worse than a marathoner. What they do to their knees is ungodly. He's in his 60s. He's got a lot of knee arthritis, but his goal is to run every Ironman in the world. So I said to him last time he came in, I said, "Tom, how many Ironmans are there?" 40. "How many have you done?" 20. So he's got 20 more to do, which is a lot of stress on your knee. So we're going to talk more about arthritis of the knee, running, impact, and how regenerative medicine can help you.